Every morning, millions of seniors reach for vitamins, believing they are staying healthy. But what if some of those supplements are doing the opposite? What if they are quietly stealing your vitality instead of protecting it? Recent research reveals that nearly half of all adults over 60 are taking vitamins that either do not work for aging bodies or actively harm them. But here is the good news. Once you understand which vitamins to avoid and which ones you truly need, you can feel sharper, sleep better, and have steadier energy. Today, I will show you the 4 vitamins that might be causing problems and the 4 essential nutrients that can genuinely restore your vitality. Everything is backed by clinical research and real stories. Before we begin, drop a comment below telling me where you are watching from and what vitamins you currently take. I read every comment and often reply with personalized advice. And please subscribe to Arthur Senior Health so you never miss important health information designed for people over 60. Now let us start with a vitamin millions of seniors take daily, believing it protects their heart when it might actually be doing the opposite. The 4 vitamins to avoid after 60. Number 1. Synthetic multivitamins. Walk into any pharmacy and you'll see them. Bright bottles labeled complete multivitamin for seniors. They promise everything in one convenient pill. But here is what those labels do not tell you. Most of these multivitamins are filled with synthetic compounds your body does not recognize or absorb properly. They are made in laboratories using cheap chemical forms not extracted from real food. When you swallow them daily, these artificial nutrients can build up in your liver and kidneys, creating stress on the organs trying to keep you healthy. Robert, a 72-year-old retired engineer, took a popular senior multivitamin for nearly 10 years. When he started feeling weak and lightheaded, blood tests revealed elevated liver enzymes and dangerously high vitamin A levels. His body had been slowly accumulating synthetic vitamins, making him sick. These multivitamins often contain mega doses of nutrients seniors do not need. They can include synthetic vitamin A that builds to toxic levels. They can include iron that most seniors already have too much of. They can include cheap forms of B vitamins that aging bodies cannot absorb. If you want a multivitamin, make sure it is food-based, meaning the vitamins come from concentrated whole foods, not laboratory chemicals. Better yet, most seniors do better taking just a few high-quality targeted supplements instead of one pill trying to do everything. Number 2. High-dose vitamin E. For years, vitamin E was marketed as the heart vitamin. Millions of seniors still take it in high doses, 400 to 800 international units daily. Large research studies tell a different story. High-dose synthetic vitamin E does not protect your heart. It can actually increase the risk of heart failure and bleeding problems. The confusion comes from mixing natural vitamin E from food, which is beneficial, and synthetic vitamin E from pills, which your body handles completely differently. Most supplements contain only one synthetic form, and taking large amounts throws everything out of balance. Natural sources are balanced the way your body expects. George was 72 years old and had been taking 400 international units every day for years. After a minor fall in his garden, he developed extensive bruising and blood in his urine. The high-dose vitamin E had been interfering with his blood clotting, causing serious bleeding. Research from Johns Hopkins confirms seniors who take more than 400 international units daily have significantly higher rates of heart problems and bleeding complications. Get your vitamin E from real food instead. A handful of almonds, sunflower seeds, a splash of olive oil, or half an avocado gives you all the natural vitamin E your body needs, perfectly balanced the way nature intended. Number 3. Iron supplements. Iron seems essential. We know it carries oxygen in the blood, but after 60, most people do not need extra iron. In fact, most seniors actually have too much iron stored in their bodies, and adding more can be dangerous. When you are younger, your body releases excess iron naturally. But after menopause and as we age, we stop releasing iron efficiently. It builds up in tissues, particularly the liver, heart, and brain. This accumulated iron oxidizes, literally rusting your organs from the inside. It fuels inflammation, damages liver cells, accelerates brain aging, and increases the risk of heart disease and Alzheimer's. Evelyn, 76, had been feeling tired and foggy for years. Thinking she was anemic, she took iron supplements for years. But blood tests revealed her iron levels were nearly double what they should be. All those years of supplements had been poisoning her system. Once she stopped, her energy returned and her mental clarity improved. Studies from Harvard and Mayo Clinic link high iron levels in seniors to increased cognitive decline and heart disease. Unless your doctor specifically diagnoses iron deficiency through blood tests, you should not be taking iron supplements after 60. Check your multivitamin label. If it contains iron, consider switching to one without it. Number 4. Mega doses of B6. Vitamin B6 is sold as the nerve protector in supplements labeled nerve support. But when taken in high doses above 100 milligrams a day, it does not protect nerves. It destroys them, slowly, silently, sometimes permanently. This causes peripheral neuropathy, with tingling, numbness, burning pain in the hands and feet, and loss of balance. For many seniors, these symptoms come on gradually and are mistaken for diabetes or normal aging. They never suspect their nerve support supplement is the cause. Henry, 69, came to his neurologist convinced he had dementia. He was forgetting things, losing balance, and experiencing terrible numbness. Tests showed his B6 levels were 3 times normal. For 2 years, he had been taking a nerve support supplement with 200 milligrams of B6. Every day, he was damaging his nerves a little more. Nerve damage from B6 toxicity can be permanent if caught too late. Your body only needs about 2 milligrams daily, easily met through chicken, fish, potatoes, and bananas. If your supplement contains more than 10 milligrams of B6, consider stopping it. The 4 essential nutrients your body needs. Now let's talk about supplements that genuinely help. These are scientifically proven, safe, and effective in the right form and dose. Number 1. Magnesium. If I could recommend only one supplement for every person over 60, it would be magnesium. This mineral is involved in over 300 processes in your body: heart rhythm, blood pressure, blood sugar control, muscle function, nerve signaling, sleep quality, mood, and bone strength. Yet nearly 70% of seniors aren't getting enough. As we age, kidneys excrete more magnesium. Common medications like diuretics and acid blockers deplete it further. The result is a silent deficiency showing up as racing thoughts at night, muscle cramps, heart palpitations, constipation, anxiety, and high blood pressure. Dorothy, 79, struggled with terrible insomnia for 3 years. When her cardiologist noticed heart palpitations and realized she might be magnesium deficient, he recommended magnesium glycinate 300 milligrams every evening. Within 2 weeks, she noticed a difference. Within a month, she was sleeping through the night for the first time in years. The key is choosing the right form. Avoid magnesium oxide, which barely absorbs. Look for magnesium glycinate or magnesium malate. Most seniors do well with 200 to 400 milligrams daily, taken in the evening. It helps calm your nervous system and prepare for deep restorative sleep. Number 2. Omega-3 fatty acids. Your brain is 60% fat, specifically omega-3 fatty acids, EPA and DHA. These are essential for brain function, but your body can't make them. You must get them from food. Most seniors are running on empty, and the consequences show everywhere: aching joints, heart rhythm problems, and slower, foggy thinking. Research shows seniors with higher omega-3 levels have significantly lower heart disease rates, better cognitive function, less depression, and longer lives. A Harvard study found 27% lower risk of dying from heart disease. John, a 73-year-old veteran, came to his cardiologist feeling exhausted and mentally foggy. Tests showed dangerously low omega-3 levels. After 3 months on high-quality fish oil, with 1,000 milligrams of combined EPA and DHA daily, his energy returned, thinking became sharper, and even chronic knee pain improved. Choose wild-caught fish oil or algae-based EPA and DHA. Make sure it is third-party tested for purity. Look for 1,000 milligrams of combined EPA and DHA daily. Take it with food and be patient. It takes a few weeks to build up, but once it does, you will notice clearer thinking, a more stable mood, and less inflammation. Number 3. Vitamin D3 with K2. After 60, your skin cannot make vitamin D from sunlight efficiently. Nearly 70% of seniors are deficient. Low vitamin D means brittle bones, weak muscles, poor immunity, and increased risk of depression and cognitive decline. But taking vitamin D alone can be dangerous without vitamin K2. Vitamin D tells your body to absorb calcium, but without K2, that calcium has no direction. It can deposit in arteries instead of bones, hardening blood vessels while bones stay weak. Eleanor, 78, took 2,000 international units of vitamin D3 daily for years. A scan showed early artery calcification. When her doctor added vitamin K2 in MK7 form at 100 micrograms daily, her next scan showed calcification had stabilized and bone density started improving. The ideal combination is 1,000 to 2,000 international units of vitamin D3 daily, with 100 micrograms of vitamin K2 MK7. Take them together with a meal that contains fat. Many quality supplements combine both in one capsule. Number 4. Vitamin B12, methylcobalamin. Vitamin B12 deficiency affects nearly 4 out of 10 people over 60. It steals mental sharpness, drains energy, and mimics dementia. Most people have no idea it is happening. They just feel slower, more forgetful, more tired, and assume it is normal aging, but it is not. It is a treatable deficiency. B12 is essential for red blood cells, the protective coating on nerves and brain function. As we age, stomachs produce less acid needed to unlock B12 from food. Symptoms include memory problems, confusion, balance problems, numbness, mood changes, and extreme fatigue. Frank, 74, came to his neurologist convinced he had Alzheimer's. He was forgetting names, missing appointments, and getting lost driving familiar routes. Blood tests showed critically low B12. After 6 weeks on methylcobalamin at 1,000 micrograms daily, his memory returned, confusion lifted, and his energy came back. He did not have dementia, he had a vitamin deficiency. The form matters enormously. Avoid cheap cyanocobalamin. Use methylcobalamin or adenosylcobalamin, forms your cells use immediately. Most seniors do well with 1,000 micrograms daily as a sublingual tablet or capsule. This is especially important if you take metformin for diabetes or acid blockers for heartburn. These medications interfere with B12 absorption. Take action today. You now know which vitamins to avoid. Synthetic multivitamins with fillers and mega doses, high-dose vitamin E that harms your heart, iron supplements most seniors do not need, and mega doses of vitamin B6 that can damage nerves. And you know which supplements genuinely help. Magnesium for calm and better sleep, omega-3 fatty acids for brain and heart health, vitamin D3 paired with K2 for bones and immunity, and methylcobalamin B12 for mental clarity. Here's what to do right now. Check your medicine cabinet and see what you are taking. Check labels for problematic supplements. Note if vitamins are synthetic or food-based. Verify that B12 is the right form. See if vitamin D includes K2. Then make a list of the 4 essential supplements. You do not need to buy everything tomorrow, but start prioritizing what your body actually needs. Talk to your doctor before making major changes. especially if you take prescription medications. Remember, the goal is not taking as many vitamins as possible. It is taking the right ones, in the right forms, at the right doses. Quality over quantity. Supplements should complement a healthy diet, not replace it. Now I would love to hear from you. What vitamins are you currently taking? Were you surprised by anything today? Leave a comment below. I read everyone and often reply with specific advice. If you found this valuable, give it a thumbs up and share with friends or family who might benefit. Subscribe to Arthur Senior Health so you never miss important health information for people over 60. Your health after 60 does not have to be about decline. With the right knowledge and choices, you can feel stronger, think clearer, and enjoy life more than you have in years. Thank you for watching. Take care of yourself, and I will see you in the next video.